Come in.
Hello. Hi, my name is Ashley and I'm going to be your nurse today. The plan is, what I'm going to do is get a set of vital signs, do a head-to-toe assessment, and also get a full history, if that's okay. Do you have any questions before we start? Okay. I'm just going to close the door, wash my hands, and get everything together, okay? And can you tell me your name?
Jocelyn Ignacio.
And what brings you in today?
Just a physical exam.
How are you feeling overall?
Good.
Can you tell me where we are?
Prepare Princess Anne.
And what's the date?
It was the 16th of June.
Alright. Patient is awake, alert, and oriented. Speech is clear. Affect is congruent with her mood. Patient is well groomed. She's dressed appropriately for the situation and season. Purposeful physical movements, body movements noted, no voluntary movements noted. No physical deformities noted on initial assessment. Posture is good, sitting in bed. And now what I'm going to do is get a set of vitals, if I could. I'm going to start off with your temperature first. Could you hold that a few times for me? I'm just going to check your pulse. Temperature is 98.6. Respiration 16. And pulse is 78. And then I'm just going to check your blood pressure. Can I borrow this arm? And relax. Blood pressure is 116 over 62. Very good. Now I'm just going to check your vision. I'm going to sit you up a little bit. Can you see that chart over there on the wall? Okay. Do you have any contacts in right now?
No.
Okay. Can I get you to cover your eye with your left eye or right eye? And then just can you read the smallest line that you can?
A, B, C, D, E.
Okay, and if you could just switch it over to the other side. And then with the smallest line you can read from that eye.
A, B, C, D, E.
Okay, and then I'm just going to have you keep that eye covered. And then just let me know when you see my finger.
Okay.
Okay, and then cover the other eye again. And then let me know when you can see my finger.
Okay.
Okay? Patient has 20/20 vision with no corrective lenses. Has good peripheral vision. And then with keeping your head, just keep your head straight. And then try to follow with my finger with your eyes, okay? Okay. Patient has good, normal, parallel tracking of the object of my finger. And now I'm going to have you focus on my nose, and then over back there. And I'm just going to use my pen light. And then, very beautiful. Pupils are equally round and reactive to light in a combination. External eyes are symmetrical, no drainage noted, no lesions. Corneas are smooth. Irises are flat and round with even coloration. Okay, now I'm just going to check your scalp and your hair. Alright. Patient's hair is black with highlights. No lights noted. No lumps on the scalp. Patient's hair is straight, good texture, not brittle. And patient, I'm just going to check your face here. Any tenderness there? All right. Ears are sitting equally on each side of the head, no tenderness on palpation. I'm just going to whisper some letters and numbers on each ear and then just repeat them after I.
5, 8, B.
Okay.
Three R, 7.
Beautiful. Alright. Good hearing bilaterally. Skin is consistent with ethnicity. The color is good. There's no lesions on the face. Can you open your mouth for me? And then put your tongue up for me. And then stick it out. Alright. Patient's mucosa is good. Saliva is present. Palate is pink, teeth are white, and they are straight. Have you noticed any tenderness or dryness in your mouth at all? And now I'm just going to check your neck. I'm going to check your pulses first. Pulses are strong bilaterally and equal. I'm just going to check these pulses here. Pulse is strong and equal bilaterally at the brachial and radial peripheral pulses. Okay. Neck is symmetrical, no lumps, lymph nodes not palpable. And then I'm just going to check the muscles in your neck, okay? If you could just push against my hand with your head. Okay. And can you bring your neck forward and back? And then push up against my hand with your shoulder. Good muscle control. The skin on the chest is also smooth, free of lumps or discoloration. Now I'm just going to listen to your lungs and your heart, if I could. If I could get you to sit up, I'm going to listen to the back first. I'm just going to go under your shirt, okay? And deep breath. I'm going to pull this up a little bit if you want to cover with your. And I'm just going to check your spine if you could bend over just a little bit more. The spine is midline, no bumps or unusual curvature noted.
Yeah.
Okay. I'm just going to check your lungs first in the front, okay?
Yeah, I agree later. He's not ready yet. Okay, bye.
Lung sounds are clear bilaterally. And I just take a deep breath on it. Chest expansion is symmetrical. Breath sounds are noted in bilateral lobes and laterally anterior and posterior. No adventitious breath sounds. And then now I'm just going to listen to your heart, okay? I'm going to be listening to your 4 valves of your heart, which are your aortic, pulmonic, tricuspid, and mitral valves. Okay. I'm going to pull this up. Sorry. And I'm going to listen to the apical pulse for a full minute. you are audible, no murmurs at all. And then I'm just going to check your belly. Okay, I'm going to listen and I'm going to press on it, see if there's any kind of pressure or anything. Lean back a little bit. Okay. Just breathe normal. Southbound present in all 4 quadrants. I'm just going to press on your belly a little bit. Do you feel any tenderness here? Okay. Liver is not palpable or tender. And then I'm just going to here. Any tenderness? Sorry, are you ready to let go? All right. Spleen is also not palpable. There's no unusual deformities or any tenderness upon palpation. Regular contour, abdomen is flat. And then now I'm just going to check your pulses here. Okay. All right. Pulses are present, equal and strong bilaterally. I'm going to check your legs now, okay? Decent. Color is good, no edema noted. Going to check the pulses down here. Your posterior tibialis. Strong and equal bilaterally. And then I'm just going to take your socks off. Dorsalis pedis. Also strong and equal bilaterally. Calf refill is good. Skin is intact. No hair noted on the legs. I'm just going to have you, are you able to move your leg out this way? Just your leg. Or this leg here, out, and then back in. And then bend your knee towards your chest. And then down. Good hip motion, good range of motion. Can you do the same with your this leg? And then if you can push up against my hands with your feet. And then down. Good muscle. Able to follow command. And then now, if I could, I'm just going to have you walk about 10 feet and then come back. Okay. Gait is good. Even arm swing. Turns are smooth, rhythmic, and effortless. Okay. And then I'm going to have you remain standing. I'm sorry. I'm going to have you close your eyes. And then what we're going to do, I'm just going to have you go like this, alternate. Accurate and smooth movement. And then you can sit down now if you like. And this is the final test. I'm just going to have you close your eyes, and I'm going to be touching you with either cotton tip or paperclip, okay? And then just tell me where you feel it and if it's soft or sharp. Okay? All right, I'm going to do your face first. Okay, and which cheek is it? Right. Okay. Now I'm going to do your arm.
No, sharp on the left.
Okay, going to do your finger.
Sharp on the
Okay.
sharp on my right leg. Soft on the left.
And that concludes my exam. Do you have any questions or anything? Okay, beautiful. Thank you so much for everything.